Our spines consist of three main segments. There is the cervical spine, which is essentially your neck. There is the thoracic spine, the middle of your back. And then there is the lower back, the lumbar spine. And the most often overlooked part of the body are the discs that are between all of these bones. These are small cushion-like pads that are essential for movement and to maintain space for the nerves that leave your spine. They also act like shock absorbers between the vertebrae. But when they're under strain, whether from congenital issues, whether from degenerative issues or sports-related trauma, they can be very painful and they can disrupt our lives. Today, we'll talk about prevention and treatment, show how to keep your back in tip-top shape to answer all of your questions. On this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, a show where we encourage our viewers to send in their health-related questions. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. And let's kick things off with a question from Facebook. This question is from Anton. Hi, Dr. Brusovanik. I was recently diagnosed with osteoarthritis in my spine, and it's very painful. I was told to stay active, but don't irritate the affected area. I need some serious Brusovanik-istic advice. Anton, thank you for coining a new term. I think I'm going to use that. I'm sorry that you're in pain. And I'm happy that you are proactively reaching out for assistance. Look, clearly, this is a confusing answer. Stay away from things that are painful, but stay active. The answer for most of us is really to stay within the confines of our pain. And if playing tennis is perhaps too painful, but running is not, then I would stick to that. If playing tennis is comfortable, but playing basketball is not, then I would stick to what your body allows you to do without pain or with minimal pain. Now, that being said, if all activities produce pain, then what you really need is a diagnosis. You need to speak to a specialist who is going to obtain an MRI, find out why you are having back pain, and then solve that problem. Usually, the solution is not surgical. So don't let that scare you. I hope this answers your question. Our next question comes to us from Gracie. Gracie reached out to us on our very own website, allhealthtv.com. And to our viewers, I would really encourage you to check out that page. Gracie asks, Dr. B, can congenital spine issues lead to other health problems or complications later in life? I'm asking because I'm 40 years old and the scoliosis I have in the middle of my spine is slowly worsening. Gracie, thank you for reaching out to us with your question. We are here to help. But before I share my thoughts, let's check out this video from the Mayo Clinic.
Most people with scoliosis have a mild spinal curve that can be monitored by their healthcare team over time or treated with a back brace and physical therapy.
Most individuals who we see, greater than 90%, do not need any form of a procedure.
But according to Dr. Jamel McClendon, when surgery is necessary, it's usually minimally invasive, improving safety and recovery time.
The future is very bright, keeping things very safe for patients who need to undergo these operations. We try to keep things as small as possible, particularly if there's quite a bit of growth remaining in our young patients. There are some individuals who have very large curvatures or large progressions of curves in which we have to do some operations with limit mobility, but then we may just have to restrict to some activities, but they still can lead very, very active lifestyles. Scoliosis is a condition that is very treatable. Having a good relationship with the scoliosis doctor and a scoliosis team overall helps with the long-term planning as it relates to making sure that curves don't progress, and if they do progress, that you have a provider who is focused on you as the individual so they can tailor a treatment accordingly.
For the Mayo Clinic News Network, I'm Jason Howland.
Gracie, thank you again for your question. So your question about congenital spine issues is a very relevant one, and there are two important points I can tell you. First of all, thoracic scoliosis is actually rarely painful, especially in younger patients. Most of the time, it's sort of an incidental finding in that when I ask a patient to bend forward, I can see that their back is a bit asymmetrical. So blaming your scoliosis, blaming your back pain on the scoliosis may not be justified. Now, when it comes to congenital issues, another very common problem is known as spondylolysis. It's much less well known than scoliosis, but it's almost equally as common. And essentially, it is a failure of formation of a little bridge of bone involving usually one of the bottom two vertebrae. The one characteristic finding that these patients have is that they'll report that they'll have pain when they bend backwards. It's very specific. Some of them will have pain going down the leg. Some of them will say that I can't sleep in my bed, I have to sleep on the floor. When you just look at these patients, it's hard to tell that there is a problem. And if they have scoliosis, it's a common mistake where the practitioners will try to address the scoliosis without diagnosing spondylolysis. Spondylolysis is a congenital problem that leads to spondylolisthesis, where your spine essentially shifts forwards little by little as that disc degenerates. So it's a congenital issue that gets worse as you get older. Look, you may not know whether you have spondylolysis or spondylolisthesis. So my advice to you is if you have pain, get a second opinion or get a diagnosis so that you can know exactly what's going on and what you can look forward to, what you can and cannot do. You need a diagnosis, Gracie. Okay, so Carlos reached out to us on Instagram. His question for me is, hi doctor, I've been told that I have degenerative disc disease in the lower part of my spine. I'd like to know what causes it and what kind of lifestyle changes I can make to help slow its progression. Carlos, that's a great question. I really appreciate you sending it to me, and I'd be happy to share some information with you. So everyone gets disc degeneration, but not everyone is suffering. We have great research that shows pain-free individuals who are older, when obtaining an MRI, will oftentimes find that they have significant degenerative disc. But you don't call that a disease until it becomes symptomatic. Now, if you are having problems sitting for too long, if you are having to fidget all the time in the car or at the dinner table, if it takes you a while to stand up straight, if you feel this stiffness in the morning when you get up out of the car, if you have pain going down the legs, then you have the most common constellation of symptoms related to degenerative discs in your lower back. If you have stiffness in your neck, pain behind the shoulder blade, or pain going down to the arms, then you may have a degenerative disc in your neck. Usually, pain associated with degenerative discs, it's chronic, it's episodic, and it's sporadic, meaning it comes and goes, and after a while, patients will report that they have some pain all the time. So what kind of lifestyle changes? Don't smoke. Stay active. Keep your weight to a reasonable limit. Otherwise, what you really need is a diagnosis. You need to know why you are hurting, because it's an internal problem. Many patients will blame themselves saying, well, I just have bad posture. Well, look, to all those patients, I'll tell you, your posture comes from inside. Just because you can sit up straight with your chest out doesn't mean that you can maintain that posture if it's not natural to your skeleton. So forcing yourselves may only lead to fatigue and further muscle pain. Bottom line is, enjoy your life. And if you are in pain, then you need a diagnosis. Thank you for your question again, Carlos. In case you missed it the first time, here's another opportunity to find out where to send in your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Rue sent us a question from our YouTube page. Rue's question is, hi, Dr. Brusovanik. Yesterday, my son, who lives in Los Angeles, called me saying he has an MCL injury. MCL. That means medial collateral ligament. This has me very concerned because I need to know what it is and if I should fly out to LA to speak with his doctor. Rue, I have some good news for you. You are obviously a very caring and concerned parent, and your son is a very lucky young man because usually MCL injuries, which are knee injuries, get better on their own. Medial collateral ligament has great blood supply, and if after an evaluation by his doctor, the doctor deemed that the knee is stable, the pain should get better. Consider a brace, either an immobilizer brace for a short period of time or a range of motion brace that allows frontal motion without a pivoting kind of valgus varus motion. That should let him heal in less pain. I hope this helped. And again, thank you for your question. We've got another question from allhealthtv.com. You should really check out this website. It's chock full of great information. Reed asks, hey doc, I'm trying to find out whether or not sciatica can cause extreme spasms in the back. I'm asking because I've been having spasms in my legs at night while I'm sleeping, as well as my left back area. And sometimes I have the spasms in my back while I'm walking. Hi, Red. I'm very sorry to hear you're in pain and you're experiencing these issues, especially at night. This can't make life easy when you can't sleep. Before I share my thoughts, let's check out this video from All Health TV on your YouTube page.
What we're seeing here, and focus in on those areas that you just talked about that we need to discuss.
So what we have over here, here's the spine looking from the back view. So we have the different segments in here on the spine. Those are called the bones or the vertebrae. So in between the bones, we have certain structures that we call the disc. So basically that entails the lower back, and between some structures over here, we have the nerve. Essentially what sciatica means is that there's a compression of a nerve in here in your lower back, and actually you might be feeling that in the buttock or in the leg. So that's basically what the sciatica entails. So it's normally a problem up here that normally people will feel it down in the leg.
This is a really good explanation from Dr. Mena. So basically, sciatica is nerve pain, but just like any pain that emanates from a segment of your body will inherently try to immobilize the painful segment. It will produce muscle spasms. So at night, which is our most inflamed kind of period, if you're having back pain on one side, you're spasming, and it can definitely be related to sciatica. Don't let that freak you out. Get an MRI, which will tell you exactly which disc is causing the problem, and then most patients get better with a simple epidural, or if the epidurals don't work, then there are some really great solutions these days. I gotta tell you, it's a good time to have the profession that I have, because I can honestly tell you that I can cure back and neck pain. Our next question is from Eva. Eva asks, I'm 39 years old and I have been told that I have minimal osteoarthritis in my lumbar region of my spine. My question is this: what, if anything, can be done to help make it go away? Eva, thank you for reaching out. Look, osteoarthritis is a layman's term for degenerative changes. We all get degenerative changes, and if you're not suffering, you really don't have to do anything. It's relevant for a doctor to know which specific inflammatory or arthritic change is causing your pain if you are in pain. And that involves a physical exam, listening to your story, obtaining an MRI, and trial injections to really solidify exactly where the pain is coming from. But if you're not in pain, get back on a horse and get back to having fun. If you have questions, we've got answers. And just in case, if you missed it first couple of times, here's another chance to find out how you can submit your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back to Ask the Doc. Today, we have a very special guest with us. This is my patient. This is Alex. He is here to talk about his recent experience. Thank you for being with us, Alex.
Thank you for having me.
Absolutely. So, Alex, when we met, tell me, what was your pain like? What was your life like then?
Like, my life wasn't fun anymore. I was going to work, just in pain all day. When I was asleep, I was in pain. I couldn't do all the activities that I used to love. I couldn't do any of those anymore. I was stiff. And just as you mentioned earlier, answering a question to one of your viewers, I just had the same symptoms of a degenerated disc.
What are your hobbies?
I'd love to do wakeboarding, running, playing volleyball, which was limited, so I couldn't do these things anymore.
And as far as work, what do you do for work?
I'm right now full-time in nurse anesthetist school, and which requires me to oftentimes stand for long periods of time and yeah, taking care of patients.
So what did we find after we obtained x-rays and MRIs of your back?
Well, we found that I have a severely degenerated L5-S1 disc, which was the main cause of all my symptoms.
Got it. And what were the first things that we tried to do to solidify the diagnosis to make sure that that's indeed the source of your pain?
We did an epidural injection, which made me feel immediately better. But this was just to find out if that was really the source of the cause of the problem.
So how did you feel immediately after the injection?
I didn't have any pain.
Was that
Pain-free.
was that a surprise for you that all the pain just disappeared?
Being in the profession, it wasn't, because I knew what kind of medications you were giving me.
Sure.
But if I wouldn't know, it would have been a surprise to me.
Got it. So as I mentioned before, I'm a minimally invasive spine surgeon. So Alex, you underwent a procedure. What did you have done?
You replaced my L5-S1 disc, the complete disc replacement, and you also performed the kyphoplasty to stabilize the bones surrounding the disc. So I guess to prevent bone fractures and just to make it stronger.
You got it. How long ago was your operation?
Tomorrow it will be 3 weeks ago.
3 weeks.
Tomorrow, just 3 weeks ago. Yes, yes.
So what did you notice as far as the difference from before surgery to now?
I must say my pain that I had, the issue that I had, is 1,000% better. I'm completely pain-free, but I do feel I'm still in recovery, which is completely normal. I want to say I'm about 95%, if I can give a percentage, but the pain that I had before for nearly almost 3 decades is gone. Yeah. So
You're
I'm
a lot
grateful.
tougher than me. 3 decades of pain. Are you back to work?
Yes, back to work. I was back to work within 9 days.
Really?
Yes.
9 days after surgery?
Yes, absolutely. And
Did you
I'm back in the gym.
Did you require back in the gym?
Back in the gym.
Lifting?
Yeah, lifting, but nothing crazy.
Uh-huh.
But just, going through the motions. But yeah, back in the gym, no pain.
Are you happy you
Great.
did it?
Yeah, very, very happy. It was the best decision of my life.
Wow.
Yeah, thank
That
you.
feels really good to hear.
Yeah, thank you. Super.
Wow. Okay, so did you require any physical therapy after this?
No physical therapy. I was just there overnight just to monitor everything, and the next day I was discharged.
Got it.
Yeah.
Are you happy you did it?
Yes, absolutely. I was feeling better immediately.
Really?
Thank you.
And no fusion, which, by the way, is an important point. A classic thing to do for a degenerative disc is to take away the painful segment and to put these little devices that immobilize the spine, including the screws. Now, what Alex received is a modern approach that maintains motion. It's a device that's implanted through a small incision in front, essentially beneath the belly, and it maintains motion so that other discs don't incur additional stress and the risk of having problems above and below the procedure are lower. Alex, thank you so much for visiting us.
Thank you for having me.
Absolutely. And to those who are watching, here's a reminder of how to submit questions to our show.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Up next is a question from Lexi, which comes to us from Facebook. Lexi asks, "Hi, Dr. Brusovanik, I'm 20, pre-med, and play soccer for my college team. Long story short, I have some serious neck pain that only dissipates when I take a prescription pain reliever. It started last year, but it wasn't constant. That was until I headed the ball upfield to a teammate a few weeks back. Now, I'm almost always in pain. Could it be a neck disc issue?" Hi, Lexi. Thank you for sending in this question. I'm sorry that you are in pain. Look, theoretically, heading the ball can definitely irritate a disc in your neck. And if you already have a history of some neck pain that comes on and off, that alludes to the fact that you may already have some pre-existing degeneration. When the energy that your neck incurred after hitting the ball, when that energy went through your neck, it probably settles in a degenerative disc more than in a healthy disc, and it can exacerbate your neck pain. If you're having pain now that this happened, it would be a good idea to obtain a neck MRI. Sometimes something even so painful is amenable to a simple injection, so don't assume that you're going to have to have an operation. But if you do consider about surgery, if you do consider surgery because your injections worked but didn't last, as in Alex's case, then please remember that a young person should really get a disc replacement rather than losing motion with a fusion. This was a really great question, Lexi. Thank you. This next question comes to us from Kirk, who reached out on YouTube. Kirk asks, "My husband Stefan has been having neck and upper back pain for as long as I've known him. He's had enough. So we consulted a local spine surgeon. He said Stefan's a good candidate for spinal fusion, but we've read that laparoscopic surgery is better for motion preservation and disc replacement. What are your thoughts on fusion versus laparoscopy?" Hi, Kirk, you came to the right place. This happens to be exactly my area of expertise. First, let me just say that laparoscopy involves entering your belly, and it's done with specialized tools through very, very small incisions. The reason why we can enter your belly in this way is because we can inflate your belly with air. That creates a bit of a room that allows us to work inside this room. Now, unfortunately, human spine isn't really amenable to insufflation of air or sometimes endoscopic surgery, which can be done with insufflation with water, like shoulder arthroscopy or knee arthroscopy. When it comes to the human spine, minimally invasive approach involves making very small incision and operating essentially through tubes using a microscope and a specialized light and a whole bunch of specialized tools. So when it comes to laparoscopy or minimally invasive, we should be on the same page. We're talking about minimally invasive spine surgery. Now, you said everything else exactly right. You want motion preservation. You want disc replacement. And the reason is because immobilization of a spinal segment will cause some stresses above and below. And we are seeing with classic spine surgery up to 36% of patients having to go back for more surgery. If Stefan is having neck and upper back pain, then there's a high probability that one of his lower cervical discs, usually it's C5-6 or C6-7, are degenerative. It's not a dangerous problem usually, but again, it all comes through with an MRI. Once you get an MRI, you can tell whether the spinal cord is injured or affected, and you can tell whether the problem is something urgent or not. Many patients come to see me after hearing that you have to have spine surgery. And if you hear that, I beg you to please get a second opinion. There is some great new evidence that rushing patients into surgery is oftentimes unnecessary. And if you feel like your doctor is pressuring you into spine surgery, please get a second opinion. Same goes for when you hear that you have to have a fusion. I have heard so many reasons from my patients as they describe their prior experiences with other doctors. And it's always, you have to have a fusion and you can't have a disc replacement for this and this reason. If you feel like that's the case, then please seek a doctor who specializes in disc replacement or who does a lot of them, because you may be very pleasantly surprised and you may avoid yourself having future problems. I really appreciate you joining me on Ask the Doc today. If you have any questions, please don't hesitate to use our Facebook page, YouTube page, or submit the questions right through your website. Chances are your questions are going to be shared by so many people because problems that are common are common. And if you ask the questions, a lot of folks who have the same problem will benefit as well. Again, thank you very much for joining us on Ask the Doc, and I'm looking forward to reading your questions next week. Thank you.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.